Recognizing the early symptoms of a heart attack is crucial, especially for individuals over 60 who may be at higher risk due to age-related health changes. A heart attack, medically known as a myocardial infarction, happens when blood flow to a part of the heart muscle is blocked, often due to a blood clot. Quick recognition of symptoms can be life-saving, as it allows for immediate action that can reduce heart damage and improve survival chances. The most common and classic symptom of a heart attack is chest pain or discomfort. This pain is often described as pressure, squeezing, fullness, or a heavy weight in the center or left side of the chest. However, it's important to understand that not everyone experiences intense or obvious chest pain. For some, the discomfort might be mild or intermittent, which can lead to delay in seeking help. In addition to chest pain, other symptoms frequently accompany a heart attack. These include pain or discomfort radiating to other areas such as the arms, especially the left arm, back, neck, jaw, or stomach. The pain might feel like a burning sensation, tightness, or aching. Shortness of breath is another significant symptom. During a heart attack, the heart's ability to pump blood effectively decreases, which can cause difficulty breathing. This may occur with or without chest discomfort. Many people also experience other symptoms such as nausea, vomiting, cold sweats, lightheadedness, or sudden fatigue. These symptoms can sometimes be mistaken for less serious conditions like indigestion or flu, especially in older adults. So it is vital to be aware of their potential significance. It's important to highlight that women, seniors, and people with diabetes may experience atypical or less obvious symptoms. For example, women are more likely to report nausea, jaw pain, or extreme fatigue rather than classic chest pain. Older adults may attribute symptoms to aging or other chronic illnesses, which can delay emergency response. Because of this, education about these warning signs becomes even more essential for people over 60. Being alert to these symptoms can help you recognize when something is wrong and prompt you to act quickly. If you notice any combination of these symptoms, chest discomfort, shortness of breath, pain spreading to other parts of the body, sudden weakness, or nausea, treat it as a potential heart attack and seek immediate medical help. In summary, recognizing heart attack symptoms immediately means paying close attention to chest pain or discomfort, unusual pressure or tightness, pain spreading to other body parts, difficulty breathing, and other warning signs like nausea or sweating. Understanding these signs can empower you to take life-saving steps quickly, especially if you are alone at home. Early recognition followed by swift action can make all the difference in preventing severe heart damage and increasing your chances of survival. Calling emergency services immediately when you suspect a heart attack is one of the most critical steps you can take to save your life, especially if you are alone at home after 60. Time is of the essence during a heart attack, because the longer the heart muscle goes without sufficient blood flow, the greater the damage and the higher the risk of fatal complications. The first and most important action when you recognize the symptoms of a heart attack, such as chest pain, shortness of breath, or discomfort radiating to your arm or jaw, is to call your local emergency number right away. In many countries, this number is 911, but it varies depending on your location. Have this number memorized or posted somewhere easy to access. Why is calling emergency services so vital? Paramedics and emergency responders are trained to provide immediate care that can stabilize your condition before you even reach the hospital. They can start life-saving treatments such as oxygen therapy, administer medications to reduce blood clotting, and monitor your vital signs. In many cases, emergency teams can also perform CPR or use a defibrillator if your heart stops beating properly. Delaying this call can be deadly. Some people hesitate because they don't want to cause a fuss or assume the symptoms will pass, but every minute of delay increases the damage to your heart muscle. Medical guidelines emphasize the golden hour, the first 60 minutes after symptoms start, as the crucial window where treatment is most effective in reducing heart damage and improving survival rates. If you're alone, try to remain calm while dialing. Speak clearly and provide your exact location so help can reach you quickly. Inform the dispatcher about your symptoms and any relevant medical history, such as existing heart conditions, medications you're taking, or allergies. If you have a mobile phone, keep it within reach at all times, especially if you live alone. Consider programming emergency numbers as speed dial. Some smartphones also have emergency SOS features that can call for help quickly with just a few button presses. In addition to calling for help, The dispatcher might provide you with instructions while you wait for emergency services to arrive. These instructions could include how to sit or lie down safely, how to take aspirin if you haven't yet, or how to perform self-administered CPR if you lose consciousness but remain responsive. Remember, never attempt to drive yourself to the hospital during a heart attack. Emergency responders can provide continuous care en route, and self-driving risks a crash if you lose consciousness or your symptoms worsen. In summary, calling emergency services immediately when you experience heart attack symptoms is a vital step that can save your life. Quick access to professional medical care reduces heart damage, increases your chances of survival, and ensures you receive proper treatment as fast as possible. If you are over 60 and living alone, preparing ahead by memorizing emergency numbers and keeping your phone close is essential. Don't hesitate or dial a call for help right away when experiencing a heart attack. One of the simplest yet most effective first aid measures you can take, especially if you are alone at home and over 60, is to chew an aspirin immediately. Aspirin is widely known for its blood-thinning properties, and this characteristic plays a critical role in limiting heart damage during a heart attack. A heart attack occurs when a blood clot blocks the flow of blood through the coronary arteries to the heart muscle. This blockage starves the heart of oxygen, causing the muscle to become damaged or die. Aspirin works by inhibiting platelets, the blood cells responsible for clot formation, thus helping to prevent existing clots from growing larger and reducing the risk of new clots forming. Chewing aspirin during a suspected heart attack has a faster and more effective impact than swallowing it whole. When you chew aspirin, it gets absorbed quickly through the tissues in your mouth and enters the bloodstream sooner, allowing it to start working faster to thin the blood. Swallowing a whole aspirin tablet takes longer to dissolve and absorb in the stomach, delaying its benefits. It is recommended to take a standard adult dose, which is usually one regular aspirin tablet, about 325 milligrams, or up to 4 low-dose baby aspirin tablets, usually 81 milligrams each. However, you should only take aspirin if you are not allergic to it, do not have a history of bleeding disorders, and have been advised by your healthcare provider to do so. If in doubt, the emergency dispatcher can guide you during the call. Aspirin is not a replacement for emergency medical care, but an important immediate step while waiting for help to arrive. It helps slow the progression of the heart attack and can reduce the severity of damage to the heart muscle, ultimately improving your chances of survival and recovery. For older adults, especially those with existing health conditions or who take blood thinners, it's important to discuss with your doctor beforehand whether aspirin should be part of your emergency plan. Having aspirin tablets readily available in your home and knowing how to use them correctly can be a critical component of your heart attack survival strategy. It's also important to note that aspirin is not recommended for everyone. People who have bleeding ulcers, certain allergies, or who are advised by their doctor not to take aspirin should avoid this step and rely on other emergency measures. In summary, chewing aspirin immediately after recognizing heart attack symptoms is a simple, effective, and accessible way to help prevent blood clots from worsening the blockage in your coronary arteries. This action can slow down the damage to your heart while you wait for emergency responders. For people over 60 living alone, knowing this step and having aspirin at hand can be life-saving when you experience the symptoms of a heart attack alone at home, especially if you are over 60. One of the most important immediate steps is to sit or lie down calmly to reduce strain on your heart. Your heart is under immense stress during a heart attack because it is struggling to pump blood through blocked arteries. Reducing physical exertion by resting helps prevent the heart from working harder, which can limit further damage and buy valuable time until medical help arrives. Sitting or lying down in a comfortable position decreases the heart's workload by lowering the demand for oxygen and blood circulation. When you move or exert yourself, your heart beats faster and harder to supply oxygen to your muscles. This increased demand can worsen the damage caused by the heart attack. By resting calmly, you help your heart conserve energy and oxygen, which can slow the progression of the attack. If possible, choose a position that feels most comfortable and stable. Many experts recommend sitting in a semi-reclined position, such as in a sturdy chair with your back supported and during a heart attack, especially if you are over 60 and alone at home. Avoiding physical exertion and maintaining steady breathing are crucial steps to protect your heart and improve your chances of survival. The heart is already under severe stress due to restricted blood flow caused by a blocked artery. so minimizing additional strain is essential. Physical exertion, even simple movements like walking, standing, or trying to do household tasks, increases the heart's demand for oxygen and energy. When the heart muscle is deprived of oxygen because of a blockage, pushing it to work harder can worsen the damage and increase the risk of complications, such as arrhythmias, irregular heartbeats, or cardiac arrest. Therefore, it is vital to stop any activity immediately and remain as still and calm as possible. Avoiding exertion means sitting or lying down. Right away, once you notice symptoms of a heart attack, rest helps the heart conserve energy and reduces the amount of oxygen the heart muscle needs to function. This rest period provides a better chance for your heart to survive until emergency medical personnel arrive to provide advanced care. In addition to avoiding physical effort, maintaining steady and calm breathing is equally important. Anxiety, panic, and rapid breathing can increase your heart rate and blood pressure, putting extra strain on your heart. This can create a vicious cycle where stress worsens symptoms and reduces the efficiency of oxygen delivery throughout your body. To help control your breathing, focus on slow, deep breaths. Breathe in gently through your nose, hold briefly for a second or two, and then exhale slowly through your mouth. This breathing pattern activates your parasympathetic nervous system, which helps slow your heart rate and reduce blood pressure. Deep breathing also ensures you get adequate oxygen, which is essential during a heart attack. If you feel dizzy or lightheaded, do not attempt to walk or stand up suddenly. Move slowly and only when necessary, preferably with support if available. Staying safe and preventing falls is critical, as injuries could further complicate your situation. For older adults, especially those living alone, it's wise to have a plan in place that includes easy access to a phone and a comfortable resting spot. Keep your phone close and emergency numbers programmed so you can call for help without delay. Also, try to practice controlled breathing techniques in advance so that you can naturally manage your stress during an emergency. In summary, during a heart attack, avoiding any physical exertion and keeping your breathing slow and steady are vital actions. These steps help reduce the workload on your heart, conserve oxygen, and minimize further damage. Coupled with calling emergency services, resting calmly, and taking aspirin if appropriate, these actions can significantly improve your chances of survival when you are alone at home after 60. In the event of a heart attack, especially for someone over 60 who is alone at home, there is a serious risk of losing consciousness due to the heart's inability to pump enough blood to the brain and vital organs. If you become unconscious, knowing how to respond using CPR, cardiopulmonary resuscitation techniques, or preparing for help is critical to improving your chances of survival. CPR is a life-saving procedure that helps maintain blood flow to the brain and heart when the heart stops beating effectively. It involves chest compressions that manually pump blood through the body and, if trained, rescue breaths that provide oxygen to the lungs. While performing CPR on yourself is extremely challenging, there are some important steps and preparations you can take if you live alone. First, prevention is key. If you feel yourself getting very weak, dizzy, or near fainting during a heart attack, try to get into a safe position where you won't injure yourself if you lose consciousness. For example, lying flat on your back on the floor can prevent a fall and provide a stable base if you become unconscious. If you do lose consciousness and are alone, it is unlikely you can perform full CPR on yourself. However, some studies suggest that hands-only CPR techniques, pushing hard and fast on your chest, might be possible in certain circumstances if you remain semi-conscious. These compressions can help maintain some blood flow. That said, most people will not be able to do effective CPR on themselves once fully unconscious. This is why having emergency medical services alerted immediately is vital. If you lose consciousness after calling emergency services, responders can arrive quickly to provide professional CPR and use a defibrillator, a device that delivers an electric shock to restart the heart's normal rhythm. If you live alone and have a medical alert system, wearable device, or smartphone with emergency SOS features, activate them immediately when symptoms worsen. These devices can alert family, neighbors, or emergency responders even if you cannot speak or move. In addition, preparing a written emergency plan and sharing it with close contacts can be life-saving. This plan should include details about your heart condition, medications, allergies, and instructions on what to do in case of a heart attack or unconsciousness. It is also beneficial to learn CPR yourself, so you understand the procedure well enough to instruct someone nearby if they come to help. If you have neighbors, friends, or family nearby, inform them about your heart condition and how to assist you, including how to perform CPR and use an automated external defibrillator, AED, if available. In summary, losing consciousness during a heart attack is a medical emergency that requires immediate intervention. While self-administered CPR is very difficult once unconscious, preparing yourself by calling emergency services promptly, using medical alert devices, and informing others can dramatically improve your chances of receiving timely, life-saving care. Learning CPR and creating a support network is essential for anyone over 60 living alone, ensuring that help arrives as soon as possible in such a crisis. When experiencing a heart attack alone at home, especially after age 60, informing a neighbor, family member, or trusted contact as soon as possible can significantly increase your chances of survival. Having someone aware of your situation can mean faster assistance, emotional support, and an extra layer of safety during a critical medical emergency. One of the biggest challenges of having a heart attack while alone is the lack of immediate help. If you are unable to call emergency services yourself or lose consciousness, having a nearby person who knows your condition and can respond quickly can be life-saving. This person can call 911 or the local emergency number for you, provide basic first aid if trained, and stay with you until professional medical responders arrive. Before any emergency occurs, it's important to establish a support network. Choose neighbors, friends, or family members who live close enough to respond quickly. Inform them about your heart condition and what symptoms they should watch out for if they check on you. Make sure they have your emergency contacts, medical information, and instructions on how to act in case you need help. If you have a mobile phone or medical alert device, make it a habit to keep it close to you at all times, especially if you live alone. In some cases, you can pre-program your phone or wearable device to automatically send alerts to trusted contacts if you trigger an emergency signal. When you start feeling the early symptoms of a heart attack such as chest pain, shortness of breath, or dizziness, reach out to your support person immediately if possible. Call or text them to let them know you need help and explain the situation briefly. This can provide you with reassurance and ensure someone is coming to check on you, or call emergency services if you are unable to. If you cannot speak due to pain or distress, having a prearranged plan can help. For example, you might agree with your neighbor or family member that if they don't hear from you within a certain time frame, they will come to your home to check on you or call for help. This type of arrangement is especially helpful for older adults living alone who might fear being isolated during an emergency. Additionally, informing someone reduces the risk of delays in medical treatment. The faster emergency services are alerted and you receive professional care, the less damage your heart will suffer, improving your chances of survival and recovery. Finally, emotional support during a heart attack is also important. Knowing that someone is aware of your condition and is on their way can reduce anxiety and help you stay calm. Panic and stress can worsen symptoms and increase heart strain, so having a trusted contact can provide psychological comfort in a terrifying situation. In summary, informing a neighbor or family member when you experience heart attack symptoms at home alone is a vital step to ensure you get timely help. Creating a support network, keeping emergency devices accessible, and communicating early can save your life and provide crucial assistance until emergency responders arrive. For seniors living alone, this proactive approach is a key part of heart attack preparedness. Preparing a medical ID and an emergency plan in advance is a critical step for anyone over 60, especially those living alone, to be ready in case of a heart attack or any sudden medical emergency. This preparation can make a huge difference in how quickly and effectively you receive life-saving treatment when every second counts. A medical ID is a wearable item such as a bracelet, necklace, or digital tag that contains essential health information about you. This ID should clearly state your name, any heart conditions you have, allergies, medications you are taking, emergency